and welcome. I'm Tamsin Rose, the Senior Fellow at Friends of Europe for Health, and I'm delighted to be your moderator this afternoon. Welcome to this plenary session called Co-Creating a Healthier Europe, More Health Responsibilities or Business as Usual. For the next hour and a half, we're going to explore the role that health has in the new vision for Europe. And we're delighted to say that we are linked up today to the Conference on the Future of Europe. So some of you may be watching on that platform, and we welcome you thinking about health in your engagement on the future of Europe. We want this to be an interactive session, and you can engage with us in a number of different ways. We're going to be using the tool Slido for you to submit your questions, your comments, and we're also going to be using it to poll you and ask you questions. You'll be able to find the link to Slido. If you're joining us through the Brella platform, you'll find the link to the right next to this, the stream in your sidebar. You should also be able to scan a QR code that we'll be putting on your screen. Or if you can go to slido.com, or if you downloaded the app, you can use the code EHFGP2. Joining me to make this session work well, there is the code for you to join and to put the QR code. I'm delighted to introduce a young Ashsteiner, Sarah Barragan-Montes, and she's going to be our newsroom. She's going to be keeping an eye on the social media, on Twitter, on questions and chats, and bringing some of that back into our conversation. Hi, Sarah.
Hello, Tasnim.
Thank you for that. We, of course, will also be including some of the cartoons from the very talented EHFG cartoonist Floris Udsum. And if you've been watching in the last 2 days, I'm sure you've seen some of his fantastic cartoons that really capture the essence of some of the things that we're talking about. Let's start by giving the first message to the European Commissioner, who has responsibility for health, and that's Stella Kyriakides. She's going to give us a little bit of insight about what's coming in terms of the vision for health in Europe. Let's watch her message.
Dr. Auer, distinguished guests, ladies and gentlemen, thank you for the invitation to address you today at your session on co-creating a healthier Europe. The idea of us joining forces to create a healthier Europe is topical to say the least. Because in fighting the COVID-19 pandemic, we are all in it together. And to emerge stronger, we need to pull in the same direction. Clearly, business as usual is not an option, nor is it what Europeans expect from us. Thousands of citizens have spoken out calling for a stronger EU role in response to the pandemic, and we must not let them down. To make Europe healthier, more inclusive, and more resilient, we are taking bold action across the board. Building a strong European health union is the challenge that unites us all. We are taking action to create a robust health security framework, boosting our preparedness and resilience. We need an EU pandemic preparedness plan alongside national plans and the more digitalized surveillance system to put information at our fingertips. Our health agencies, the European Centre for Disease Prevention and Control and the European Medicines Agency, will be reinforced to enable them to respond to the scale of the challenge. This pandemic is not over. COVID-19 variants remain a risk, and other health threats could emerge at any time. So speed is of the essence. And that is why I'm delighted with the creation of the European Health Emergency Preparedness Response Authority, HERA. HERA is a paradigm-shifting moment for Europe, which will help anticipate health threats and identify responses. It will enable us to rapidly deploy the most advanced medical countermeasures in a health emergency, much like we did with our vaccine strategy, but in a structural instead of an ad hoc fashion. Ladies and gentlemen, your support and ideas are very valuable to us. Your input is visible across the actions we have taken since the beginning of this Commission's mandate. COVID-19 has taken a terrible toll on our lives and on our livelihoods. At the same time, it has made us even more determined to create a healthier Europe as the bedrock of our future economic and social well-being. I look forward to working with you to make that happen. Thank you.
Thank you very much to the Commissioner for that message, and a strong reminder that the pandemic is not over yet. Although we have pulled through the worst of it, there's still variants of concern, and some parts of Europe still experiencing high levels of infection. And this has been our daily experience for almost 2 years now. We're in this online format because we still haven't returned to a point where we can engage face to face. And it would be impossible for me to overstate the impact of COVID on our lives, on our friendships, our families, our relationships, our workplace, and our economies. It truly is a transformation moment. And the question is, what do we make of that transition? How do we use it to build a path towards a healthier, more equal European Union? And this first block of conversation, we're going to just get a sense of how you're all viewing the current state of health in Europe. We're going to ask you a question. We'd like you to use Slido, and we're going to launch a poll, a word cloud, and we want to ask you what concerns you most about the state of health in Europe. We know that as a result of COVID-19, health systems have been under very heavy pressure. There's been an enormous amount of undelivered care. There are new needs that have emerged as a result of long COVID and COVID infection. So what are your greatest concerns? And let's see what comes up here. The first message we've got here is health and justice. And I think that's a very powerful message to start our conversation. Because for me, I think one of the big lessons that we learned from the pandemic is, from a public health perspective, we've always known that health inequalities are harmful to health. But the impact is slow and incremental over years. But what COVID showed us is that inequality is deadly in an immediate form. So thank you for putting that up as health and justice. Let's see what else people are putting in, and please keep your suggestions coming for the Slido word cloud. We want to see what concerns you most about the state of health. So inequality in health and justice coming forward. Issues of trust, mistrust, distrust, hesitancy, division. Yes, I think our societies have become very much more polarized, and this has an impact on trust and societal cohesion. Different standards in healthcare and preparedness. Yes, social determinants. So inequality, inequity, and injustice still coming forward as very much center to this issue. Fragmentation of member states and the rise of right-wing politics. Yes, this is also an issue. When society is not cohesive, you have fragmentation and polarization, and this can be a real challenge to the fact that the next steps we have to do together to create a new vision have to be joint. So I'm delighted I'll be bringing in a panel in a little bit of time, but in the meantime, let's just have a moment to look at that word cloud. And then what we're going to do is we're going to share a video where we ask the European young Gaststeiners their views. And these are young professionals working in health ministries, in patient organizations, clinicians and researchers. So they represent the next generation of health leadership. And we ask them the same question. What concerns you most? And let's see what they wanted to share with us.
There could always be more collaboration between the European countries and a focus on prevention instead of just reacting to problems.
We need a high-level forum to discuss challenges and opportunities of access to medicines, which includes all relevant stakeholders.
My vision for a healthier Europe is that through collaborations of member states, all citizens in Europe have access to health innovations no matter where they live.
I am concerned there is a growing disproportion between the speed of medical innovation and skills. There are major knowledge inequalities. I'm also concerned about reactive, hospital-centered healthcare models which are no longer sustainable.
The biggest concern that I have is the delayed diagnosis and the lack of testing solutions, which can only further increase health inequalities and cause another wave of mortality from non-COVID related diseases.
From my perspective, the main healthcare problem is affordability and accessibility, and what we can do, we can try to attract more funds and increase efforts focused on the prevention.
I am concerned about the high levels of overweight and obesity across Europe, particularly amongst children. We need a systems approach to improve the environments where children eat, play and live in.
My concerns are that due to the side effects of the pandemic, like social isolation or lack of physical activity, the state of health of many has declined, but we even haven't noticed it yet.
My concerns about the state of health in Europe surround heightened threats to mental health of European citizens, whether as a result of climate change or COVID-19. Governments need to commit to better and stronger public mental health services and continue to support resolutions such as the European Framework for Action on Mental Health 2021 to 2025.
When the dust will settle after COVID, we will be reminded of the big killers, cancer and cardiovascular diseases. EU countries still spend too little on prevention.
My biggest concern is staff burnout. I just don't see how we're going to recover the health of the population after the pandemic if we cannot ensure the continuing health of the clinical workforce that we need to treat people.
Thank you very much to the young Gasteinaers who shared their views and concerns. And I think they very much mirror some of the concerns we had here when we asked you. And let's see again that word cloud of elements that people raised when we asked them what concerns you most. And many of the things that were mentioned by the young Gasteinaers are up here: the health workforce availability and workload, the political divides, conspiracy theories, loss of community care, the challenges of the climate emergency, delayed diagnosis, lack of solidarity and insufficient European integration, individualism. So many of these elements came up with you, the audience, and also with young Gasteinaers. Let me introduce a panel of distinguished guests who are going to help me unpick some of these issues and explore a little bit about how we come out of this crisis and try and keep some of the best elements of what emerged and use them to build a vision for a healthier Europe. So I'm delighted to introduce Milka Sokolovic, the Director General for the European Public Health Alliance, Michel Calabro, the Policy Advisor for the European Patients Forum, Annick de Ruyter, the Associate Professor for EU Health Law and Policy from the University of Amsterdam, and Howard Catton, the CEO of the International Council of Nurses in Geneva. So you represent a range of different civil society organizations and views. And let me just start with you, Milka, and invite you to reflect on what you saw both in the word cloud and the views from young Gasteinaers. Are they the things that concern you most?
Yes, definitely. And thank you for that, Tamsin. I would say the words in that cloud, including inequity, injustice, mistrust, ring loudest in my head as well. And indeed, we find ourselves in times of huge crises, and not only one, but a wicked combination of medical, environmental, and social crises. Our health is threatened by the COVID pandemic and then hugely exacerbated by a horrendous pressure on our health system. And that's what we have heard from the young Gasteinaers. Our economies are in turmoil. Our human rights, and that has been mentioned in the cloud, are increasingly challenged. Our democracy is rapidly declining. It's pushed by the eroding trust and by the growing misrepresentation of science. And on top of it all, our planet is in peril and the climate crisis is showing its ugly teeth. Unfortunately, these interconnected challenges that we face separately and in combination affect the most vulnerable among us, and that's where the inequality comes to the fore. And this COVID monster, so to call it, has fed off social and economic determinants of health. It has put and push the health inequalities into the spotlight. And it has taught us, like the first graders, that the interconnectedness of problems asks for an interconnectedness of responses. I must say that despite the optimism that the vaccine development has temporarily brought, we seem to be slowly reverting to business as usual. We know now, after all that we have seen and experienced during COVID, that the solutions lay in the society and not necessarily only in the hospitals, in people and not in treaties. But we seem to be choosing not to ignore them. So thank you. Over to you, Tamsin.
Thank you, Milka. Michele, can I invite you to come in and share patient's perspective, because of course for many of them their routine care was disrupted. We know that people were afraid to go to hospitals and get treatment. There's a huge impact for people living with chronic conditions, rare diseases. What's the view from the patient's community?
Thanks, Tamsin, first of all, for the nice introduction. And to begin with, indeed, the workloads and the words of my fellow Youngersteiners are pretty much on point with what our community, the European Patients Forum community says. Actually, I would like to start with a real couple of numbers from a recent survey that we run. 95% of patients experienced challenges during COVID-19 pandemic. 65% of the respondents to our survey experienced increased stress and anxiety. And 49% of the patients surveyed actually experienced treatment delays, exactly as you said, Tamsin. These difficulties in accessing healthcare, increase inequality, social isolation, a reduced sense of safety, mental well-being, and also bringing back the point that was made in the workload and by yourself, Tamsin, about lack of information and trust issues. These are all concerns that are very much at the center of the work that we are doing with our patient community, but actually applies to the entire European population and beyond. In particular, and I think the video from the Youngersteiner made it clear, they're also very important for young people, young professionals, and young citizens of Europe. One point though, all these challenges are not really new. Most of these were exacerbated by the COVID-19 pandemic, but actually many of them, it's something that civil society, patient organizations, health NGO have been working on for years and years. Just one example, indeed, health literacy or vaccine hesitancy, it's not new. And as Milka said, I think more preparedness to this crisis, but also going forward, should really come from listening to the experience of civil society, to the experience of people, to citizens, and to all individuals that actually are very much at the center of healthcare in Europe. And one key concern, just to close, it's how do we move indeed beyond the crisis? How we make sure that once again, we're not going to talk about this in 5-6 years as, again, not having learned the lesson once again.
Thank you for that. Anik, let me bring you in. Where do you feel we are? What are your biggest concerns about our current health situations?
Thanks, Tamsin. And of course, I would first of all like to echo some of these concerns that were just raised. What I'm very concerned about is two actually quite different things. The first one is more sort of societal. I'm worried that we haven't really given enough weight to the grief, to all the people that died. I haven't seen any sort of there is no intention of national days of mourning and things like that. And I think we haven't grieved enough as a society over the amount of people that died, the friends that were lost, the grandparents that were lost, etc. And so that is one thing that I think that everybody's talking about, building back better and all of these kind of words like building and constructing new things and just getting over it and moving on and rebuilding the economy and all of that. And I'm wondering, like, have we actually taken some time to reflect and to sit still a little bit? And then the second thing that I also worry about, and it is to some extent related, because in that whole discourse of building back better and now we're really gonna fix some stuff, there is a lot of focus on the economy. And will this then also cause, again, investments in health and in public health, in community health, to go down? And we already are seeing that public spending, needs to be cut because we've been giving so much money to the economy to help people, etc. So now do we enter a new time where public spending for health is cut to benefit the economy or other services, especially when COVID has shown us that it's not about your emergency preparedness, all of that. It's really about the strength of the population health,
community health, that is what brings resilience to a society. It's the ongoing boring stuff, actually, that makes a population healthy, and that creates readiness for these kinds of crises. So those are the two things that I would like to highlight on top of the things that the others have already said that I'm worried about.
Thank you, Annika. And I think you're right to bring up this issue, because if we look back to, let's say, the 2008 financial crisis and the overall impact that had on a whole generation of young people, and we see the long-term scarring effect on their life chances, on their economic opportunity, their social mobility, there's a really, a lost generation there. And there is a real risk that as a result of COVID, we will have generations of children whose schooling was disrupted quite significantly and who then fell behind and couldn't be caught up and brought back in, people whose employment chances have been affected, people who lost family members, who were unable to provide the care they would like to under these dramatic circumstances. So as you say, there is a moment for society to breathe and reflect and acknowledge the pain and trauma that's just happened before immediately rushing forward and trying to sort of rebuild some incredibly productive economy and get back to where we were. Because every survey I've seen shows that people don't want to go back to how things were. They don't want to have the same stresses, they have the long commutes, the long hours, that people have now refocused on things that matter, things that value. Green spaces, social connections, belonging, meaning and purpose are really coming forward as the things that people want and value. And I think that links very nicely to what Milka said about the climate emergency. The planet is burning, and for it to be a livable place for humanity, we have to take action now. And that's linked to the decisions we take about our economic models going forward. Howard, let me bring you in and bring in particularly some of the global perspectives, because in Europe we can often fall into a little trap of regarding our own navel and not looking elsewhere. And yet we are part of a global interconnectedness, and we have an impact, positive or negative, on the global context. Howard.
Thanks very much, Tamsin, and a pleasure to be with you. As Tamsin said, I'm from the International Council of Nurses. I am a nurse. There are about 27 million nurses around the world. For me, the perilous state of our healthcare workforce is the paramount issue that I am concerned about, and many of our associations around the world are. The nursing workforce is exhausted physically, but also has taken enormous mental health burden and toll. We did a survey earlier this year of our more than 130 national nursing associations, and over 90% of them said they were receiving reports of psychological and mental health distress from nurses. And this is complex. You delve into it. It's not just about anxiety and burnout. There are people suffering post-traumatic stress disorder symptoms. There are people who are having to deal with the consequences of policy failure where there isn't enough equipment, enough ventilators, enough oxygen. It's our health workers who have to look people in the eye and make literally life and death decisions. It's our health workers who are then subject to verbal and in some cases physical attacks because people are fearful that there have been contagions of the virus. They're the target of anti-vax messages as well. We called this, when we reported the mass traumatization of the nursing workforce, some people said they thought that was a bit strong, but if you look at the evidence, I think the evidence justifies that sort of a descriptor. Let's not forget, from a nursing perspective, we came into this pandemic already 6 million nurses short globally, and estimated there's something like an 18 million shortage of health care workers. Nurses, health workers, they've heard the applause and the claps, but I think becoming tired and frustrated about the lack of action on the ground. We've got a real issue around the world now about still our inability to vaccinate all healthcare workers. It comes on the back of not being able to provide PPE at the time that people needed it. And the point that Anik made about not having time to grieve. One of the things we've been trying to do at ICN is to monitor numbers of nurses, health workers who have become infected and died from COVID. We've run a report on it. You can see the numbers that we've picked up on a website, but you know what? It's down to organisations and our associations to find this data, because far too few countries are reporting and collecting this in a systematic and a standardised way. We might want to speculate why that is, but the applause ring hollow when you actually don't know and countries can't say these are the number of people who have died. And without that data, as dull as the data can be, we all know it takes us to a better understanding and better protection. I think, Tamsin, I'm of course pleased to hear some of the ambition that I hear coming forward from the EU. I really don't think it goes far enough. I think the EU should be more ambitious about how it can play a major role in supporting the development of the healthcare workforce, not just in Europe, but in many other countries and regions as well. Back to you.
Thank you very much, Howard. And again, we recognise the valuable work being done by the nurses associations and other healthcare professional networks to try and quantify the impact on the health workforce of what's just happened. And I think it raises a point that links back to the word cloud that we created, where the number one concern that came in and was social injustice and inequality coming out in many different ways. Because here we can see that the impact of the pandemic did not fall equally on all members of society, that the risk did not fall equally, and that often it was the people who have the least job security, the least political power, the least financial recompense who had to bear the brunt of the exposure to the risk, and often also their family members. So I think the COVID pandemic has revealed to us, held up a mirror to show the ugliness of the social fractures in our society. And I think the real question is, what do we do about it? Now that we have seen it, we cannot and should not unsee it. And I think this is the interesting challenge that we're going to discuss in our next section, where we're going to move to the question, COVID was a game changer in a number of different ways. And some of the changes that were brought in terms of increased use of telehealth and digital tools, intersectoral collaboration, the role of science and evidence being brought further into policy making, some of these changes might be useful legacies that we would want to keep. So what we're going to do is I'm going to ask you, the audience, to share with us what are the positive changes or legacies that you think COVID delivered to us in the last 18 months that you'd like to keep. It might be more people cycling. I live in Brussels, and the number of people who use their bikes to go to and from work has increased dramatically. Maybe it's the fact that there's a new focus on physical activity in green spaces. There's a lot more people who learn how to make banana bread and are more interested in their food and well-being. So let's ask you, we're launching a new poll on Slido. What should be the lasting legacies of change that we want to embed and keep for the future as a result of the pandemic? We concentrated initially on some of our concerns and negative impacts. We want to give a chance to reflect and say, where do you see positive change that we should keep, that should be the foundation stones of how we move forward? And thank you, we've got a message about more real solidarity. And yes, I think this goes to the point that we spoke about earlier, that the injustices in the way that we organise and manage our societies were made very clear. Togetherness. I think that's a very poignant message, given that we're all connecting from computers. We're in a virtual space together, but the opportunity to touch each other, to hug each other, and to have this social connection has been lost. So togetherness, and recognizing that you have neighbors that you could help and be with. Across Europe, we saw, and around the world, a flourishing of local initiatives, grassroots ideas, people delivering food parcels to each other, checking if elderly neighbors need help. The best of solidarity came forward. So thank you. Got lots of suggestions in here. Cycling, as an avid cyclist, I would agree from that. Working from home, uptake of digital innovations, empathy, a push for digital innovation, yes, strengthen governance, Health high on the national agenda. Yes, that can be a double-edged sword sometimes, and we'll pick up on that in a little bit. Awareness on well-being. Humility, that's interesting. Family values, yeah, the importance, we're suddenly reconnecting the importance of our social connections to neighbors, to friends, to people who are living in the same house, particularly to elderly relatives, people with caring responsibilities, who we suddenly realize just what it is they do for us and how they keep our societies running. So thank you for that. Lots of really positive ideas, willingness to collaborate coming forward as well. So we'll come back to that cloud in a minute. But first, I'd like to go back and hear from our young Gasteiners, because we asked them the same question. What are the positive legacies that they would like to keep from the COVID-19 pandemic? Let's see what they want to say.
Destigmatization of mental health issues such as burnout or loneliness, which will hopefully raise awareness and increase their resourcing.
Stakeholders have worked so well together during this pandemic by having a structured dialogue. Let's keep this collaboration going.
The pandemic showed the value of open science and collaboration and enabled faster access to the results of medical research for the benefit of the citizens. I think these are positive changes that will stay and transform our societies.
On the positive note, we became a society that is keen to recognize symptoms and take ownership of our own health, which is a great opportunity for patient-centered care that we all wanted to see advance for so many years.
The creativity to organize everyday life was a change that I would like to see also in future, because it activated personal resources, and for me it's a promising approach for a resilient society.
The COVID-19 pandemic has uniquely and disproportionately impacted youth, disrupting future trajectories, as well as widening digital divides and health inequities. Yet, amidst these challenges, today's youth have demonstrated innovation and resilience, while simultaneously advocating for improved health features.
Some countries embrace online medical consultations, which may be one tool to provide better access to health services for some hard-to-reach parts of the population.
We have embraced more flexible and potentially healthier ways of working, allowing people to work from where they love.
Normalizing working from home to reduce the time spent on unproductive and sleep-depriving commuting.
How did the pandemic change the way we look at things? And one thing which comes into mind is that there really has been a rethink in the way we move from one place to another. And if we look towards embracing active mobility, then that's a big win for public health. So I am definitely happy about that.
Industry and academia work together to deliver us with vaccines in record time. The king is naked. When we want, obstacles to innovation can be overcome.
Thank you. And what a strong message there at the end. When we want to do something, we make it happen. Obstacles can be overcome. We're going to use that sense of possibility to explore with our panelists some of the same messages. What would we like to keep? And the intersectoral collaboration, the ending unuseful and sleep-depriving commutes, flexibility, working from home, appreciation of each other's contributions and roles, lots of positive things identified by our young Gasteiners. And before I bring in our panelists again, I think we've got some cartoons from Floris that help us pick up on some of these ideas. Let's see the cartoons. So here we can, he's indicated the Social Injustice League. These are the things that we don't want, and certainly are not going to save our European society because they make it more vulnerable. And a lot of the things you picked up on, inequality, mistrust, misinformation. So this is the Social Injustice League. We'll have to think about what are the heroes that we could bring in to address this. Let's see if we have another cartoon. Yes. Should we do more than putting out fires? I think, again, that's a very good point, and we can see it in many different ways. Part of it is the pandemic was such an enormous emergency that it mobilized everyone and everything across society and across healthcare systems, but that drew away resources, staff and equipment from the routine care and other things they needed to do, which meant we now have a lot of other fires that need to be up, not least the impact on our workforce of what's just happened. So, and here's the final one. Yes, no one is safe until everyone's safe. That's the slogan that's been repeated many times by the World Health Organization, even by the Commission. But there's the challenge. If some parts of the world have the vaccine, have the power and the capacity, and they're all right, their house is safe, what about the rest of the world? And I think that's a very telling message for us to take forward. Let me bring back my panel and invite them to tell us what would be the things they would like to keep, that they hope would be a lasting leg that COVID has gifted us with in the way we think about our societies. Milka, let me start with you.
Yes, thank you, Tamsin. Let me pick up on some of the keywords that I've either in the Slido or heard from the young Gasteiners. For me, the pandemic has brought to the forefront the innovation and collaboration in a completely unprecedented way. For me, the neck-breaking speed in which the vaccines were developed and the startling alliances between academia, industry, and governments to produce and distribute the vaccines were fantastic, but they have also left us wanting for more and craving to see science and not politics in the driving seat. I would also like to pick up on the complexity and interconnectedness that the COVID has brought. We learned that there is no area of our existence that is not affected by another. There is no boundary between health, climate, environment. We cannot look into the health and well-being of people without the well-being of the planet. And not only that, we now have more than enough evidence to prove that there is no single global issue that can be addressed separately, but we have also learned that no single actor can succeed on their own. So back to collaboration. But for me, most of all, the pandemic has caused a true mind shift. It has unleashed a huge energy. It has brought to the light the power of solidarity and togetherness. And it has resurfaced the power of cities and communities, the power of ordinary people in their ordinary neighborhoods. And that, for me, is the legacy that we should by no means abandon. Over to you, Tamsin.
Thank you, Milka. Michele, would you like to also share from the patient's perspective?
Yes, of course. Just building on what Milka said, I think one very important point is that the pandemic, although it's a crisis, it brought health to the center of EU and national agenda, showing how important it is. But then again, it happened in a crisis, but it's something that citizens have been asking for. How many times have we mentioned the Eurobarometer survey about how much more health in the EU citizens want? So I think this is a first important bit. It has to stay high in the agenda. In terms of individuals, in terms of citizens, in terms of patients, I think increased health awareness, it's one important summary element of what was brought by the pandemic. I think it showed everyone the importance of prevention. It showed the importance of healthcare workforce, although I do agree with Howard. It has to be then shown with actions and support going forward. And it accelerated, just to mention another thing, the digital transformation of healthcare. Again, also here, how we did it, it's something that we also need to sit down and reflect, because it did happen, but it could have happened in a way better way, also from the patient point of view. One last bit from my side, I think, it showed that it's indeed possible to work together at European level and even at global level. And it showed that health is really something that we cannot deal with at local, regional, or even national level anymore. But at the same time, I think this leads to a little bit of accountability on how we're going to do it going forward. As was mentioned actually in one of the messages from the younger Steiners, it's all about willingness. It's all about how we're going to keep continuing doing and adopting this collaborative approach rather than just forgetting about it when the crisis is over. So these are the things that we should really keep in mind.
Thank you for that. Anik, let me bring you in and ask if you think that a European Health Union with its ambitious ideas of how the EU leads from the front for health across all of its policy areas, do you think that would help to achieve some of the elements that both Milka and Michele have mentioned?
Yes, I think to some extent this is a very good development that these calls are out there for a European Health Union. I think currently the European Commission is very much focusing its ideas on emergency preparedness, etc. And I think what some of the others have been saying as well is that we need a stronger infrastructure for health in the EU. And for that, we have also the European Health Initiative, in which we have been calling for a stronger infrastructure on many different areas. For instance, one of them also the importance of the EU's role in global health. But I think one thing that Milka said I very much disagree with, actually, and that ties into this idea of a European Health Union. She says that we should put science in the lead. And as a lawyer, I would disagree with that. I think science is very important for policy making, but I think we should put politics in the lead. And one of the things that we've been calling for with the European Health Initiative is for more EU legislative power and in the field of health. And what that does is create a stronger health politics at EU level. And I think that is very important because in the end, choices always have to be made, and those choices have to be made in a legitimate manner. And right now, because there's hardly any power in the EU, legal power to create laws, a lot of others become involved, not the health community. And so the health community, some of these are scientists that are powerful at member state level, or at least more powerful. In the EU, really don't have a voice at all. Because, for instance, representatives in the internal market make EU health law rather than, people involved in the national or representing the health ministries. And so that is something that is very important, is we need more health politics at EU level, also empowering some of the health representatives at national level. And so that is really something that our initiative of a European Health Union is calling for. And that is where I think politics shouldn't be in the, but it should be the people involved in health politics.
Thank you for that. So with it, politics is decisions, about how to deliver health, and that science has a role, but it shouldn't necessarily be just the lead. We need legislators step up and take their responsibility. Before I bring in Howard to give us his view on how the EU can become a health union, let's go to Sarah and see if we've had any questions submitted on Slido. Sarah.
Thank you, Tamsin. Discussion as well on our social media and also on the Slido questions and answers that the audience is submitting. So there are many echoes to some of the key messages that we're hearing from our panelists. The fact that we are going to meet more and more interconnected challenges, medical, social, or environmental, that these are going to be hitting vulnerable populations the most. There are also many echoes on social media to the call from Aniek that we really need some time to grieve. And also the acknowledgement of the many challenges that our workforce has had, not just during the COVID-19 pandemic, but even before the pandemic, such as the shortage of nurses that were mentioned before. Now, we have received three main questions. All of them are actually concerning funding. So all of the participants that are interacting with us in the audience, they all certainly agree that we need to co-create health, but they wonder, how do we do that if the health budget is decreasing, including at the European Union level? How is that decreasing budget going to support the participation of civil society in co-creating health? And another main concern that is coming out from them is mental health. With the increasing challenges from the pandemic in mental health, how are we going to ensure sufficient funding? And yet again, one of our participants is also pointing out that maybe we should be focusing on investment in health as a key contributor to the economic growth, to make that economic case, investment case for health. Over to you, Tamsin.
Thank you, Sarah. Obviously, lots of interest and ideas being put forward in our social media and in our chat functions, and keep that coming as we help to co-create a vision ourselves about a European health union. Let me bring in Howard, because you can help us have a view from the outside. The EU has an ambition to be a global actor for good. And here we've got a call for European Health Union, which would look at an ambitious way for all of health policies, all the way that the EU legislates and the way that it allocates money to be aligned to meet health and well-being. Howard, do you see that as being possible? Do you see the EU as potential major power force as a health union?
I think that the EU has the potential to be a much more ambitious and influential global health player than it currently is. If we just talk about the shortages in health workforce that we're seeing, Europe is very concerned about shortages within its area, but they pale into insignificance when we look at the global situation. About nearly 90% of the nursing shortages are concentrated in lower and lower middle income countries. But what is one of the responses of some EU countries to shortages within their borders is to go and recruit from those other countries. And what I've heard recently as a justification for that is that there are health workers, there are nurses in some of those other countries who are unemployed. So it's okay to go and recruit. It is true that there are lower income countries, low middle income countries, where nurses and other healthcare workers are unemployed, but that does not, in my view, automatically take us to a place where it's okay to recruit. They're unemployed because there's a lack of investment in those countries. But if you look at the ratio of patients to nurses, health workers, you look at the level of health care needs, they need support to be able to employ those healthcare workers and to increase education. The EU could, through the innovation, the expertise in relation to education, research, health technology, could become an educator, an innovator, take a lead role to support other countries to capacity build. And I think that there could be a huge shared and mutual interest from the EU as a trading bloc in comparison to other trading blocs and its place in the world. Interestingly, just this week, the government of France announced a new development with the WHO, an academy to bring education and lifelong learning to the world. So I think there is that potential. But I think there are some really hard questions to be asked internally about where countries have not invested, have not done the proper workforce planning, have not released the potential with their own workforce. One final point on this one, Tamsin, which is it goes back to your question about a positive which has come out of all of this. I think that the image of nursing, of many healthcare professionals, has changed as a result of the pandemic. People have seen the reality beamed into their front rooms through TV screens. And what we're seeing a lot of the time is how new models of care, non-traditional medically led models of care, more community-based outreach, preventative services to support people who are aging, non-communicable diseases. There are some really interesting new models of care which can build on the expertise we have in our workforce, but do things in a different way, where they're community based, they're integrated, where they're people focused as well. Europe is sat on many of those examples, and again, it could be in a really strong place to support other parts of the world to strengthen their health education systems and their health systems as well, which we all know ultimately it's in all of our self-interest for all parts of the world to have stronger health systems.
Thank you very much, Howard. And again, you've highlighted for us, and it's sometimes useful to get a view from outside the EU to look in at us and remind us just how much innovation and flexibility and resilience our health systems, and particularly the workers within it, were able to deliver to rise up and meet this challenge. I think we've got a few cartoons from Floris that help us illustrate some of the topics that we're talking about. Can we see his latest cartoons, please? So now I'm going to come back to our members of the panel and ask them, with the plans that we've got at the moment for the European Health Union, are they enough? Do we have the right powers? Do we have the right legislative capacity? Do we have the right political ambition? Do we have the tools to meet some of these ambitious goals? And remember, Howard said, we need to ask ourselves some quite hard questions about the way that we have chosen to invest in our health systems, the way that we've chosen to organize them. So let's have a brief roundup, just a minute each. Milke, let me start with you. Have we got the tools to deliver on an ambitious health union?
Yes, thank you. I'll be short on the tools. I think the knowledge is there, the data we have, the tools are there. It is, I would say, the political will that is missing to harness the learnings and move forward. And we have quite good examples out there on the different ways that the people and the civil society can be integrated into the work, and of different ways of looking into the economy and of the success of our societies. I think we can take, for instance, the food as the case study and learn from the massive efforts undertaken under the auspices of the United Nations Food System Summit, where the sense of urgency, the systems approach to complex issues, the interactivity, interconnectivity between the top-down and bottom-up are second to none. Also, the EU can learn from the WHO and their growing interest and investment in the whole society participation. And there, I would like to stress that the recognition of the value of the non-state actors is not arising from political pressures, but from the realization that involving civil society is the best way to achieve the positive health impact. And I would just like to quickly quote Dr. Mike Ryan of the WHO, who says, let me read it out for you. The non-government sector are providing core services on behalf of the government. That is not charity. That is about a government being able to design a policy that delivers part of its service through the community sector. That funding has to be stable. And that's also picking up on one of the questions from the audience. So another point I'd like to make that there is a framework for different measure of society's success, the one of well-being economy, and that's also linking to what Anik was saying about looking into economy versus the health and well-being of the society. The OECD has proposed that framework, and it features health and well-being and not only the GDP as measures. So it is not only about looking into the economic growth agenda, we need to have a different look into it. So yes, shortly, we do have the knowledge, we lack the political will, and I'm afraid that we are increasingly lacking trust that the governments and systems are able to deliver. Over to you, Tamsin.
Thank you. Michele. Thank you, Michele. What about you? Do the current proposals for a European Health Union go far enough? If not, what else should we be calling for?
So in terms of the current European Commission proposal for a health union, I think it's a good starting point, meaning, again, as before, it's the first time that we are talking about the European Health Union, but it's not the first time we would have needed to do that. Actually, the idea also responds to a series of calls that were made from political groups, citizens, civil society. So just to begin, it is it is a good positive outcome. It's a positive tool. And it's linked to all the series of, ECDC strengthening, EMA strengthening, the development of the European health data space, the increased work on preparedness and emergency response. So I think in terms of individual initiatives, something is moving. However, when you ask me, is this enough? I think it's not enough in the sense that the European Health Union should not just be looked at as a sort of, label initiative, a basket where we put all these initiatives together. This is important because it is the time to bring everything that the EU and member states are doing under a new, let's say, framework. But we have to go beyond this. We really need to try to create a vision for a true European Health Union that would, first of all, of course, have citizens, patients, and all people at the center. And it has to be, let's say, more of a coherent vision and a driving principle going forward, rather than, let's say, we solved the crisis, we launched a bunch of initiatives, that's it, let's now move to economic growth. I think it has to really stay at the center of the discussion, and I think it's very important to keep this in mind. So it is a good starting point, but much more can be done to leave the space for true European Union to deliver actually to Europeans.
Thank you. Let me bring in Anique, because you were a bit critical earlier by saying we're not actually using the full range of tools that we have. If we're going to deliver on the vision of the European Health Union, we need to be linking in our legislative frameworks, the political processes, and the financing mechanisms to make them all work together. So Anique, what else do we need to do to translate the idea of a health union into reality?
Yeah, I think what was just said is very important. We need a broader vision of what we mean by a European Health Union, keeping in mind the incredible differences across health systems, the inequalities of health systems in Europe. But it needs to be indeed more than just a couple of new proposals that are, of course, I mean, they're still going much further than what we would have thought about 2 years ago. But it needs to be a vision for health in Europe, and it needs to be an idea on the horizon that considers all these differences, that considers the inequality, but still has an idea of like what could be the added of the EU in the field of health, and also how can, for instance, because at the national level, health is also often the weakest link of government. So also at national level, what can be done? What can Europe do to increase the power of health representatives, of health professionals in the context of policy making, in the context of all kinds of financial distribution decisions, public spending decisions that are being made. And so there, I think the EU can have an important role. And some of that can be done through law. Of course, if we can change the treaty and give the EU more power, I think that will empower national health representatives vis-a-vis their counterparts in other ministries and the related civil society. But I also think that there needs to be evidence on the ground, and this is just how it is in policy making. So, for instance, there's now the idea to create national response plans in this new legislative proposal by the Commission on cross-border threats. I think something like that, a monitoring instrument of the quality of health, of what is available at national level, and a role for the EU in that, can be quite significant, even if it's now being put into a proposal on preparedness and health threats. I think it can have a broader impact, looking at health quality, safety of care, etc., across member states. So there, I think maybe the way forward is create a vision, start doing stuff, and then at some point, I think the law will follow. But I do agree very, very much that we need to have a vision that is more holistic than what is currently put on the table.
Thank you, Anique. And before I move on to the next section where we're going to pick up on this vision, I just want to pass back the floor to Milka, because a couple of our comments that came in from the newsroom highlighted this issue of financing. There's more money for health, but how are we using it? What are we spending it on? And I think the importance of investing it strategically to improve not just our health systems, but our society resilience. And I think, Milka, you've got some contributions on that.
Yes, thank you, Tamsin. I think it's an important point to make. There is, with the health now being brought to the center of our attention due to the pandemic, a huge budget put aside for health in Europe. But it is a question how we are going to spend it. I would like to make a point before answering that question about the importance of the civil society in the response to pandemic and in general in health and in public health. In this pandemic, the civil society has responded spontaneously, not encouraged by, but rather in reaction to the lack of action in some circumstances from governments and systems. So it was cities and citizens, and it was nurses, doctors, scientists that made the difference. It was neighbors and extended families and grassroots organizations. So in this pandemic, the small level has become the highest level. But there is a growing concern, and I've mentioned it already, that we are losing the momentum and that we are sliding back to the olden ways. And we see that despite the buzzwords and soundbites and taglines, that the citizens are again being used as an excuse in decision making and in policy making, while being sidelined and deprived from real influence. And the best example and the most recent ones include the setup of HERA that was just discussed in the previous session of the Gestein Forum, without civil society at the table, nor the parliament for that matter. But also we see it in the awkward withdrawal of structural funding for the European health NGOs within the EU for Health program. And we are now finding ourselves in the time of largest health crisis in the EU with the highest health budget. Actually, our current budget is larger than all previous health programs together. And at the same time, the NGOs contribute the most that is possible, and other DGs bend over backwards to support their NGOs in these challenging times. And I would say, if we are to translate the learnings from the COVID pandemic into a meaningful EU health union, we must not revert to the centralized modus operandi. We need the civil society to be heard, people to be recognized and respected. And for me, the civil society that is integrated and funded and carefully maintained, that is crisis preparedness in my book. And that is how democracy is safeguarded. Thank you, Tamsin, for this opportunity.
Thank you very much. And we're now moving to the section where we see what we can do next. And I'm going to, we've got lots of content to bring in. I'm going to start by sharing the video from young Gasteiners with their vision for healthier Europe. Then we're going to bring in some questions from the audience, from Sarah from the newsroom. And then we'll kick off again. I'm going to be bringing in Howard in with his views on what the EU should be doing. But let's start by seeing the video, Young Gasteiners, Hopes and Visions for a Healthier Europe.
I hope for a future of Europe in which prevention becomes a top priority and healthcare does not mean just a place, but mindsets, political will, and empowered citizens. A future with common European standards for the education of the medical community.
My hope is that we are able to educate citizens in order for them to be empowered to critically appraise health information that they read online and not be vulnerable to misinformation campaigns that jeopardize public health.
It is crucial for the health of EU citizens that the trust between EU institutions, NGOs, and industry is re-established.
My vision for a healthier Europe is that through collaborations of member states, all citizens in Europe have access to health innovations no matter where they live.
My vision for healthier Europe is for everyone to have easy access to testing for COVID and other diseases without any barriers or extra costs, which is still not the case in all of the member state countries in Europe.
My hope and my vision is that we share our experiences, our knowledge, or even our data from this time, and that we enable the citizens to strengthen their health literacy through multi-stakeholder collaboration.
My hope for a healthier future in Europe is one in which all European citizens, children and youth in particular, as their health futures are the most at stake, are meaningfully engaged in the design, development, implementation, and evaluation of all policies, programs, services, and tools which have an impact on their health.
My vision for a healthier Europe is to use digital tools to connect the patients and the healthcare providers in a smart and intelligent way.
I dream of a future where all European citizens have their genome analyzed to create personalized risk scores and help them manage their health.
A healthier society is one where people are placed at the center of decision-making processes, particularly patients and young people. They are the ones who face the burden of ill health and will live with the consequences of our inaction today.
So there we have some views and hopes and visions for a healthier Europe from young Gasteiner. And I think this gives us some ideas of where we could look to strengthen the role that Europe has. But now let me bring in Howard, because I'd like you to give us some sense, again, slightly from the outside, what Europe could and should do to improve its health profile and its political commitment to health. Howard.
Many thanks, Tamsin. Let me just start from the inside, though. I just wanted to, I suspect some of you, like me, have been watching the news about the truck drivers shortage, which has particularly been playing out in the UK, but then the debate about how short of HGV or truck drivers we are across Europe. And I was just struck by the media reporting on this, the focus on shortages, poor pay, underfunding, lack of good facilities, and people we've got 50,000 shortage here, 100 here, 60,000 here. It pales into insignificance compared to the shortages and the issues in our healthcare workforce. And then it made me think about what we've seen with this panic buying of fuel, because people say, well, we've got the fuel, we haven't got the drivers. Well, what would that translate to into health? Because you can't separate care from the people. People, health workers, are the care. So if we continue down this road with our shortages and lack of investment in the health workforce, what would panic buying look like for healthcare? Well, I think it would look like rationing. It would look like us having to do more to care for our nearest and dearest. In the US, as part of which is reports in recent days in response to their care shortages, some states are having to bring in the National Guard. That's very much a glass half empty, but I don't think that we should shy away from describing what the consequences could be for lack of investment in the health workforce, which is why then in terms of what EU could be doing as part of its vision, I think there is firstly a much bigger role for that to be informed, supported and advised by health professional leaders. Where's the chief nursing officer for the EU? How does the EU demonstrate that it is in a really meaningful way getting advice from the frontline healthcare workers and professionals into policy decision making? Yes, we need stronger political leadership, but we need a stronger WHO. I think they've done a fabulous job during the pandemic, but they have been limited by lack of financing and support from them. I think we have also got some areas where we have some gaps in data as well. We have a vision. For me, the vision, whatever a vision of future, the broad, bold, ambitious vision for future of healthcare in Europe, for me, what I would be then looking to see is the health workforce plan that is central to that. It's the golden thread that would run through that vision. It would, it's critical to delivering on whatever that vision is. And some of the aspects, just to give you a flavour of what I think some of the aspects of that health workforce plan that should be central to the vision should be. Do you really understand your current numbers of health workers? the supply coming in and your future needs, demands. What can you do to scale up education? What education capacity you've got? What could you do together to scale that up, not just for new entrants, but for continuing education? Pool to collect, to get the fabulous new models of care, different models of care that are already out there, to share, disseminate them critically to get people to fund some of those new models of care. Not have a very clear standards, the conditions, the fairness that we want all of our healthcare workers to have. Just some ideas, Tamsin.
Thank you, Howard, and indeed some very valuable ideas and some questions that we need to ask ourselves and to see, you know, where are we allocating our capacity and our efforts. Let me now bring in Sarah from the news team, because I think we've had more input, more questions and more suggestions, because we opened up now to this question of what's the vision, what should we be aiming for, and Howard gave us some insight there, particularly with a focus on the workforce. But what are you seeing in the newsroom?
Indeed, thank you, Tamsin. So very interactive audience still. We have a couple of questions from them. The first one is question to our panelists. What do they think is the best platform where decision makers should engage with communities? And in particular, they ask about the youth and about vulnerable populations. Then a second question about workforce. They ask, why is health workforce policy not yet a priority, including their mental health after the COVID-19 pandemic? What else do we need for this to become a priority for our policymakers? And then we also have a comment related to workforce. One of our participants says that we really need to focus more on what critical workforce is, based on the lessons from the COVID-19 pandemic, both inside of the healthcare sector, but also outside, our truck drivers, our supermarket workers, our cleaners, etc., all people that have supported us during the past months and years. Over to you, Tamsin.
Thank you, Sarah. Some really interesting questions and insights being put forward. And I think this question about, you know, where policymakers can engage citizens to understand what citizens expect, because we can see from Eurobarometer surveys, citizens want more. They want Europe to do more in ways that will support their health. But where are the mechanisms to have that dialogue? And Milka, you know, highlighted for us the vital role that civil society organizations have in mediating that, in bringing forward some of these voices and putting it to policymakers. But that needs adequate structural funding. Let me see, I think we've got some cartoons from Floris, who's been tracking our conversation and bringing his own unique and creative perspective on our conversation. So let's see the cartoons. So now in this last segment, I'd like to come back to our panel and pick up on some of those things that were mentioned. And if for the last 18 months, health was the central policy, all other policies were subservient to health, making sure we protected the health of the population and maintained the sustainability of our health system so they could meet it. So health was very much in the driving seat. As the threat of the pandemic wanes a little bit, there's a risk that health might be sidelined as some of the other big beasts come to the table. I'm thinking about the finance department, the treasury, who start saying, now it's time to cut budget, and other departments say, well, now time for us to get some of that money. So let me ask our members of our panel, health got a seat at the big table. How do we keep that seat and make sure that we're in the driving seat? Milka, I know money is a core preoccupation at the moment, but how do we translate that into political power and leadership?
Okay, let's start with money. So let's start with the economic arguments. Pardon. Well, the EU hears the economic arguments, but I think in order to make a real difference and keep the health at the table, the EU must open its ears and heart and soul to the social and the health arguments. Otherwise, the fear is real that the current guest chair for the health at the great EU table will be put aside again, and that health Cinderella, lovely and lovable but powerless, will return to her crumbs. I would say to keep to the fairy tale theme, I think that we may still have a chance to live happily ever after if we take on board those learnings from the pandemic, and if we make sure not to make a glass slipper of a good crisis. COVID has brilliantly, although painfully, underscored how intricately economic well-being is connected with the health and the well-being of the society. And it has clearly demonstrated that these are complementary rather than competing objectives. And the OECD has recognized them as such, and I've mentioned it already and already proposed. So then a proposal of my own from the civil society perspective, how about a grand wedding ball for EU and people with the economy and well-being as guests of honor? And if necessary, we could have an interpreter until we all eventually start speaking the same language. Over to you, Tamsin.
I like that idea of a grand wedding party where we all start to learn to speak the same language. Howard, can I bring you in on this? You know, health at the discussion table. Let's make sure we're not shifted off to the lower table while the other big policies take the big space.
So I think there's firstly a reminder to everyone about what do you need to do to make sure that this doesn't happen again. If you don't keep health at the table, if you don't follow through on the very hard lessons we and the world have been taught, this pandemic has shone laser-like onto our weaknesses, our fragilities, onto our inequalities. It's actually been very, very helpful to tell us what's wrong and what we need to address. And part of your legacy, if you don't learn those lessons, that will be part of your legacy and the risks of the care crisis, of the other care crisis that I talked about a few moments ago. But then I think there's another side to flip it into, the really positive elements that are here as a result of our learning and experience. But for Europe, for me, some of the things around Europe's ability to be a powerhouse driving education, innovation, health systems development, and that's not just some sort of vanity project or initiative. I think that if the EU ambition is to be an even stronger bloc globally in political terms, in economic terms, in trading terms, I think that there's a massive amount that health can do to help achieve those political ambitions as well. And then just very, very, very simply, I would just like to have in place mechanisms where our political leaders are regularly and consistently hearing the true, honest voices from healthcare workers and healthcare professionals about what they're dealing with, what the challenges are, what some of their solutions are as well. I would like to see a much more equal partnership between the political leadership and the professional leadership. And enough with if we get that and we don't hear any more applause or clapping, I'd happily trade that.
Thank you, Howard. Annika and Michele, can I ask you to make the bridge to the conference on the future of Europe? And we're delighted that we're hosted on our platform and this message is going out. How could that help because that's a big vision exercise to see what kind of Europe we want. Michaela and then Aniek, briefly.
Yes, so absolutely, it is a bridge that has to be there and has to be exploited. I think one point is to start from what's there already. We had a lot of discussion about the concept of health in all policies that could really make this connection between us, health community, speaking with economics and environmental and so on, make it happen. So I think this could be one key point that should emerge from the Conference on the Future of Europe, really make it the future of Europe. Another point that I would really like to do, I think the Conference of Future of Europe can touch and improve on an important point, which is not only how citizens and communities speak with policymakers at EU level, but also how we bring back the information, because that's a point that I think is still lacking. And I think it is why also trust in institutions, it's also lacking at this very moment. So I think, yes, it is important to engage in the Conference of Future of Europe. It is important also to have accountability on how the results of the Conference of Future of Europe will be taken back and implemented. It's clear we want more health in the EU. How are we going to make that happen, and how we can be accountable to citizens?
Thank you, Michaela. Aniek, briefly, and then before I pass to the MEP, who's going to close us off with some conclusions, I have a gift for each of you. I can give you Aladdin's lamp, and if you rub it, you will get 3 wishes. So I'm going to ask you, Aniek, you can finish your intervention with that, and then the others, 3 wishes for a stronger, healthy union. Aniek.
Yeah, so for the future of Europe, and sort of, I guess these are also my wishes, since they're about the future, and Aladdin's lamp gives me that power to have a wish for the future. I think one of the most important things that I would like to stress for the future of Europe is that national health politics, so national parliamentarians, national civil society, national people working in policy, that they start seeing that the EU for them can be an opportunity and not a threat for their goals for health policy making. So if you look at these actors in the economy or in agriculture or in other areas of EU policy making, a lot of the national political engagement has EU as an opportunity to further their objectives. Whereas in health, this has not happened. In health, people have seen the EU as a threat, and they have tried also in the treaties again and again to stop the EU from having any influence in health. And it hasn't worked. It just has created not very well adapted policies because the health community hasn't been involved. So start seeing the EU as an opportunity, because in the end, the EU is nothing more than a group of member states. So it has to come from the member state. It has to come from the national representatives, from national civil society as well, together with EU civil society. But really start seeing the EU and its legislative system and its policy-making system as an opportunity rather than a threat.
Thank you for that. Milka, what could Aladdin's lamp deliver for you?
Okay, I'm swiftly flying in on my Aladdin's rug, and I have wishes on 3 levels. On basic people's level, it would be to see a health and social support network for free for everyone, no questions asked. On the member states level, I would love to see the Ministry of Plenty, so economic affairs, and the Ministry of Healthy, so health and social affairs, in the co-driving seats. And at the EU level, wouldn't it be wonderful to have a vice president for health? And now, seriously, a no-nonsense wish would be for a strong, structurally funded civil society with permanent seats at all the EU tables. Over to you.
Thank you, Milka. Howard, what could Aladdin give you as 3 wishes?
I said I think that a costed health workforce plan at the centre of the vision, it would be something serious for me, along with this health professional partnership and advice at a top political level as well. But look, if you're handing me that Aladdin's cave, bear with me. I cannot but not say that one of the things I would wish for would be a pay rise for all healthcare workers. And I'm not being flippant by that. There's a more serious point for me. I think that the pandemic has exposed the true value of what so many of our countries and societies have undervalued for years. And this isn't just about nursing, health workers, care workers, public transport workers, supermarket workers, truckers, even, as we about before. I think that there is a serious reevaluation of how we economically value what is most important to us, what holds us together, what creates cohesive and peaceful and safe and secure. So I would give everyone a pay rise at that Aladdin's lamp, but there is a more serious point beneath that, rather than just playing to my constituency, if you forgive me.
Yes, of course. Michela, I'm going to come back with you to give you one last wish.
Yeah, just one last wish. I think von der Leyen made clear the importance of youth in her last State of the Union and called for a 2022 as year of European youth. Just saying, let's make it count for health. I think the European youth is ready for that. We have to do it. We have to do it now.
Thank you for that, Michela. Thank you to the members of our panel for sharing your visions and your views, your concerns and your plans, your wishes for what the European Health Union could deliver. We're going to be inviting the member of the European Parliament, István Ujhelyi, to comment on that. But before we do, I'd like to bridge to him with a final cartoon from Floris with his vision for us. Floris. Thank you for that. Let me introduce István Ujhelyi from the European Parliament. We've had a really lively debate, some fairly critical views about the scale and ambition of what the EU does and how it moves away from technocratic counting what it invests in health systems to a more broad approach. We've had a strong call for financial recognition for health and key support workers, the need to support civil society and to engage with different stakeholders. István, how do you take this forward?
Thank you so much, Rose. The last 1.5 hour was the real consultation about the health issues on the European level. It was the on the future of the European Union. That's why it was very interesting for me. And you know, for the past 2 years, when I introduced my initiation and idea of quality standards, European quality standards in healthcare, and the establishment of a European health union, I always apologized for not being a doctor or a professional health worker. I have always emphasized that I'm only a Hungarian politician who is truly committed to the issue of public health. But it happened a lot since then. After 2 years, the European Health Union is already under implementation. And as you remember, the European Parliament, together with the colleagues, we started to push the European Health Union project. And finally, it was a huge and historical step when Ursula von der Leyen, President of the European Commission, stated at the World Health Summit in October 2020 that we cannot wait for the end of the pandemic to repair and prepare for the future. We will build the foundations of a stronger European Health Union, in which 27 countries work together to detect, prepare, and respond collectively. In the last few months, within the framework of the Common European Health Union, the Commission has already strengthened the mandate of the European Centre of Disease Prevention and Control and the European Medicines Agency also to provide stronger surveillance and guidance during a crisis. The Commission also launched the new pharmaceutical strategy and the Europe's Beating Cancer Plan. Also, along the European Health Union, the Commission launched the new European Health Emergency Preparedness and Response Authority, which is also a huge step forward. What we have seen in the last few months in Brussels is the determined and considered implementation of the European Health Union. And I would like to tell you, I'm proud, but not completely satisfied. Today morning, I also had meetings with other colleagues from the European Parliament to push the European Union and to give more and more pressure on the Commission to have concrete actions. At the same time, I must point out other important and far-reaching steps have been taken by the Commission, because all of them are good pillars when we are talking about the next steps and when we would like to be there on board on the conference on the future of the European Union. First, the EU successfully confronted the pandemic. No more than 70% of adults in the EU are fully vaccinated. For me, one of the most important results highlighting European values was the joint procurement of vaccines. This guaranteed that all European citizens had equal access to the vaccine, and no rich or influential member state has benefited alone. This was, in fact, one of the incarnations of the European Health Union. Second, we have adopted and made available the so-called EU for Health program, which is the fourth and largest of the EU health programs since their inception in 2003, with a budget of 5.3 billion euros. Never before have been so many resources available for health programs. In this regard, I believe that this amount should be used in a wisely and targeted way, and above all, to reduce disparities in European health systems. And third, Ursula von der Leyen has proposed in her State of Union speech 2 weeks ago a new health preparedness and resilience mission for the whole of the EU. It should be backed up by Team Europe investment of 50 billion euros by 2027. I know that this financial will primarily serve to combat further epidemics, but I'm sure that it will open many other possibilities. So, dear colleagues, ladies and gentlemen, as I have mentioned, I'm truly proud, but we have to fight. Fighting against the pandemic is crucial and frankly important. But the European Health Union is not only about vaccination. The European Health Union is not only about COVID. This project, this vision, wants to have a wide and better healthcare in the EU. As an MEP, I would like to remind you that the European Parliament has adopted many documents in the last months, which reflect and refer on European Health Union and call the Commission to act. We have called on EU member states to urgently carry out stress tests on their health systems in order to identify vulnerabilities. In connection with this, the EP called the European Commission to propose a directive on minimum standards for quality healthcare, guaranteeing patient safety and fair working conditions for healthcare workers based on the results of the tests. No progress can be seen in this yet, not at all. I strongly believe that the imbalance in healthcare systems in the EU is untenable. The cross-border spread of the coronavirus and its global threat perfectly illustrate that there are challenges that can only be addressed as a community that stands united. And because the European community is built on solidarity, inequities, and inequalities in healthcare systems must be addressed. So, dear colleagues, we all need to push the issue in our own way. If the European Health Union will not be realized in the broadest way, then much of our other efforts will be also in vain. We need to reduce the disparities in public health care. Quality standards for healthcare systems are needed in the European Union. And I know that many member state governments do not agree with this at this very moment, not mine either. Ennick mentioned also this problem, what will happen in the political structures at national level or in European level. The conference on the future of Europe has already started, and if I know it right, 85 events will address the topic of healthcare, and already 500 civil proposal was received by the organizers. It means the European people care about healthcare. They are truly interested in shaping this sector. And as an MEP and a committed supporter, initiator of European Health Union, I will push this issue till the wall, because I believe that we can change the system now. So the time is here for achieve a better, fairer, more accessible, more healthcare for all. 2 years ago, I thought we weren't going to get this far either. After 2 years, now I know we can go as far as we went, but we need each other, political decision makers, action movement players, and also you professionals. So thank you for the invitation. It was my honor to be together with you.
Thank you very much, Istvan, and certainly your leadership and commitment and to really go to the wall to make sure that health has its place in the Council on the Future of Europe is really very well appreciated. Thank you all to our participants, our panelists, for having this great conversation. And clearly it is going to continue, because as we shape the new kinds of societies that we want in Europe and our role in it, health needs to have an important role. And the Health Forum Gastein continues. Just as our panel ends, there'll be other events coming up. So let me just remind you that we have a few sessions that I would like to flag up for you. At 3 o'clock, we have a session on collaborative leadership for health and well-being. And I'm sure that's up on many of the elements that we've talked about today, about the importance of adequate strategic financing, of collaboration, of dialogue, etc. And at 5 o'clock, there's a special event for the Young Gasteiners, which is on the Partnership for Sustainable and Green Future, Creating Regenerative Economy, and that's from 5 to 6:30. So thank you all for participating in this second plenary event. Keep watching and engaging with the European Health Forum Gastein in the next few days, and also with the Conference on the Future of Europe. Thank you and goodbye. Stay safe and be well.